Hello student, today we will discuss about treatment modalities for cancer. In my previous video, we saw about surgeries, chemotherapy, radiation therapy, gene therapy, hormonal therapy. Today we will discuss about bone marrow transplantation. This is the last part of treatment modality. So what is bone marrow transplant? Replacing diseased, non-functioning bone marrow with healthy functioning bone marrow. So what is bone marrow? Bone marrow is soft, spongy tissue. What it does, it produces various type of blood cells, that is red blood cells, white blood cell, as well as a platelet. What is the main function of these blood cells? Red blood cell help to carry oxygen, and WBC provides immunity, and platelets helps in a blood clotting. So these bone marrow present in a center of the long bone or at the end part of the long bone. So if any hematological cancer required bone marrow transplantation. So let me see what are the indications. So just now I said any hematological disorders as well as a cancer required bone marrow transplantation. The first one is the aplastic anemia, means failure of blood cell production. If there is no blood cell production only, means you can imagine the client will be suffering with a various kind of disorder. There is no immunity, there is no oxygen carrying capacity, there is no if any bleeding, the clotting will not take place only. So of course it's a required bone marrow transplant. The second one is a sickle cell anemia. Red blood cells are in a misshaped, means it is not in a normal shape. You know about anatomy and physiology, you studied in a first year. So you know what is the normal shape of this red blood cells. But it will be here in a sickle shape. Okay, thalassemia. Less hemoglobin and fever red, less blood cells are there in such condition also. Malignant disorder. Myelodysplastic syndrome means a type of cancer in which immature blood cells in the bone marrow, and it will not mature only. If it is not mature only, means the three type of blood cell production will not take place. The client will be suffering. So, of course, it's required. Lymphoma, cancer of lymphatic system. So what is lymphatic system? Lymphatic system include lymph nodes, spleen, thymus gland and bone marrow. Myeloma, cancer of plasma cell. So this is all 1 marks. They will ask for either theory or for the practical. Okay, very important. Multiple myeloma means a group of plasma cells become cancerous. Leukemia, cancer of WBC. The normal WBC will be 4,000 to 11,000. But in case of leukemia, it will cross 1 lakh, more than 1 lakh and all. Neuroblastoma is a type of cancer found in adrenal gland. So in all these conditions, bone marrow transplantation is required. So now let me see source of bone marrow. There are 3 types of bone marrow donors are there. So the first one is allogenic bone marrow donors, means bone marrow obtained from a relatives or unrelated donors having closed matched HLA type, means human leukocyte antigen. This has to match from the donor to antigen. They will take sample from both, also donor as well as recipient. If match only, transfusion is done, otherwise no. Syngeneic bone marrow. Marrow is donated by an identical twin. Marrow is a perfect HLA match. So in this, the success rate is a high because it is taken from a identical twins. So what is the meaning of identical twins? Identical twins means a result from fertilization of single egg by a single sperm. Then the splitting into a 2. So here the match will occur and success rate is a more. The third one is a autologous bone marrow. Bone marrow obtained from patient itself who has a healthy bone marrow requires specific doses after giving high chemotherapy or radiation therapy. So what did you understand? When client has a healthy bone marrow, why the bone marrow has to taken from his own body and a transfusion? This is done when client is exposed to chemotherapy and radiation therapy. Some extent in a mildly bone marrow suppression or damage will take place. So in initial stage itself, to treat the bone marrow, from the client itself, the marrow is taken and transfusion will be done. So you can pause the video and can write down the notes. Stem cells are collected from patient, preserved and reinfused to kill malignant cell within marrow. Okay, how as a nurse, what is your responsibility? How you will prepare donor and recipient preparation? It is a major responsibility of the nurse. From the doctor part they will do. So as a nurse, when we are caring a client, one who is undergoing for the bone marrow transplantation, it is our responsibility when donor as well as the recipient is admitted in a hospital. How you will care the donor? One is always a prior to few days prior to bone marrow transplantation, the hospitalization is a must, because the client has to undergo, the patient as well as the donor has to undergo various examination tests, and everything has to match. The donor sample has to match to recipient and recipient has to match to donor. Then only the transfusion is done. Hospitalization for what? Hospitalization for the complete ensuring mental as well as a physical well-being. Evaluation include medical history. Any client is suffering with any major health issues. In any major health issues means it is not at all the possible. Physical examination, complete top to bottom, complete blood count, chest x-ray, ECG, and the screening test, HIV, HPSAG, blood grouping, typing. So all the tests are done, and above that informed consent. The procedure is explained to the donor and the consent is obtained, as well as an adverse effect. Means after removing bone marrow, the donor will be having mild pain, fever, hematoma. So the donor should know about all these things. So hospitalization is a must. So once everything is over, now second part is a stem cell collection. Stem cell means immature cell collection done from bone marrow itself or from peripheral system, means from the circulating blood. The blood is collected. From the blood, the stem cells are isolated, preserved, and it transfused to the client if it is a matching properly means. Okay. Okay, now recipient preparation. How you will prepare the recipient? A recipient means a client, the patient, one who is receiving this bone marrow transplantation. Hospitalization, few days prior to this procedure to carry out all the investigation, as I said, for the donor, everything, physical examination, physiological examination, explanation, all kind of a screening test, blood test, everything. Then bone marrow infusion. So once the proper matching is occurred, bone marrow infusion. So when bone marrow infusion, what is the nursing responsibility or a nursing management of client who is undergoing bone marrow transplantation or a stem cell transplant? It is not like a IV fluid. Connect the IV fluid and go and just tell the bystander to wash the client if any needed to ring the bell. No. When bone marrow transplantation, it will be transfused in the form of same like a blood only with a large pouch. It will be transfused. So first one is before transfusion, the client is required proper emotional, psychological preparation, properly explained everything, each and everything, physiological, every system wise, that is already physical. Obtaining consent from the client also is required, because client should be ready during the process of transfusion and after the process, after the transfusion. If any complication or a side effect, he should know about that and he should be ready to go for that and he should ready to accept that. For that, consent also is a must. So now during bone marrow transfusion, the staying with the patient, the nurse, the specially trained oncology nurse has to stay with the patient, monitoring SpO2, close observation for any allergic reaction, vital signs monitoring. If any variation in the vital signs, immediately informing the doctor. If any allergic reaction like redness, or a patient is saying difficult in a breathing, chest tightness, some kind of a irritation, anything, means immediately has to stop the transfusion and inform to the doctor and carry out all the orders whatever told by the doctor. Maintaining intake output chart throughout the procedure, as well as after the procedure also, bone marrow transplantation over also, for the few days the intake output chart has to be monitored. Okay, post-transplantation care after the bone marrow means after bone marrow transplanted, what are the nurses' responsibility? Watch for complication. There is more chances, at least a mild, moderate, or a severe. So it may be a pulmonary abnormalities, means lungs related, edema, pneumonia, pneumonia, breathing difficult, or cyanosis, infertility also, that it will come to know later on when client discharge and go after few years, if inability to conceive or inability to give child. So it may be a part of this bone marrow transplantation, which doctor may assess. Chronic graft versus host disease. It is a life-threatening complication. Bone marrow attacking own body cells thinking foreign body. So this observation is required when client is in a hospital, as well as once go from the hospital discharge and go also. The follow-up is a must with the blood investigation. Whatever doctor is saying, according to that, the client has to follow, and it has to educated by nurse. Psychological assessment throughout the procedure to after procedure get over to until discharge. So caring for donor, same time we cannot neglect the donor also. Recipient as well as the donor, equal important has to be given. The donor experiencing mood alteration, decreased self-esteem, guilty feeling if fail means, if mismatched. See, initially when they check, it may be a matching. After the transfusion, if any complication occur, if something has happened in a patient, the donor may feel guilty. Because of me, the client is suffering. So in such kind of a feeling also, counseling is a must. Watching for any complication. As I said, there may be a chance for the pain, fever, and a hematoma, and a high fever might be there. So after discharge and go also, so that has to be educated for the client, as well as a psychological support throughout until discharge and go. So these are the nurse's responsibility when client is undergoing for bone marrow transplantation. So here student, I finished oncology nursing, from the definition to classification, characteristic of cancer cell, types of cancer cells, and each and everything, treatment modalities, everything I finished. Now let me discuss on in the next video. We will discuss on some other unit. Till then, take care. Bye bye. Those who are not subscribed my channel, subscribe the channel for the proper for the observation of my video.